Unanisikiza? Fellow Kenyans, members of the press, today I wish to commence this weekly address by appreciating the effort by the National Treasury in dispersing the outstanding balances of the equitable share of revenue to the county governments. I therefore wish to confirm that the approved total equitable share of revenue amounting to Kenya shillings 316.5 billion allocated to county governments for the financial year 2020-2021 is now fully dispersed. Additionally, conditional grants amounting to Kenya shillings, that's 8.3 billion, have been dispersed to the counties. The last amount was dispersed on 2nd July when we issued a joint statement, myself and the CS National Treasury. As a result of the release of these funds, the county governments are now prioritizing the following: payment of pending bills, payment of salaries for county staff, and scaling up intervention towards the fight against COVID-19. On this note, county governments have resources to respond to COVID-19. We, however, call upon the national government to consider additional support to counties within the Lake Region economic bloc, 13 counties, who have the highest disease burden at the moment. Further, I wish to note that the new COVID-19 Delta variant is deadly, and in some instances, it presents no symptoms, unfortunately. Therefore, we must all be careful and continue to take all the necessary precautions necessary. Having said that, in the last 1.5 weeks, 43 county governments have addressed themselves to the following critical issues: bed capacity. The hospital bed capacity, which reflects a trend of upward rise of COVID-19 admission to the counties, is as follows. Isolation beds. Last week, the total number of available beds in the isolation centers was 7,542. This number has increased by 253 due to reduction in the number of COVID-19 patients in the facilities. Currently, there are 7,795 available beds in the counties that reported. ICU beds. There are 436 available ICU beds in 43 counties. Currently, 62 ICU beds are occupied against 35 bed occupancy of the last week. This therefore rules that the total number of patients being admitted has increased by 27. HDU beds. This week, the total number of available beds in HDU facilities was 249. Currently, the number is 111 against 89 occupancy of last week. The total number of patients being admitted has increased by 22. Home-based care. As of 5th July 2021, there were 3,527 patients as compared to last week's 4,320 patients under home-based isolation care across 43 countries. This is an improvement. Home-based is doing very well. We urge all the asymptomatic patients to continue working with the community health volunteers in the implementation of home-based guidelines, which have been effective that far. Now let's move to vaccination. As at 5th July 2021, a total of 1,447,648 vaccine doses have been administered. Of these, 16,190 are for the first dose and 452,718 second dose of the vaccine. The vaccination rollout is as follows. For the first dose of vaccination, health workers, 171,539. Security officers, 86,945. Teachers, 156,954. Above 58 was there are leading with 307,777. Others, 297,928. The elderly are doing better than the security officers and the health workers combined. For the second dose of vaccine, health workers, care workers, 90,954, security officers, 35,415, teachers, 142,676, others, 128,004. We note that the demand for COVID-19 vaccine has increased with more uptake by health workers. Further, noting the donation of vaccine received from Denmark, we encourage Kenyans to consider vaccination from government-approved facilities, which is free of charge. Let's now move on to non-COVID issues. Kasi Mitaani Initiative. County government, in partnership with the State Department of Housing and Urban Development, have continued implementing the Kasi Mitaani program, an initiative designed to caution the most vulnerable youth in the informal settlement from the effect of COVID-19 pandemic. As part of the program, a training component is currently being carried out in all the 47 counties to equip the youth with industry-relevant skills such as life skills and business skills to enable the youth to be employable and productive post-COVID-19 era. Further non-COVID issues, ladies and gentlemen, may I now draw your attention to non-COVID related issues, starting with the 7th Annual Devolution Conference in Makueni. As you know, it will be on 23rd to 26th August. The theme of the conference is multi-level governance of climate action, subnational mobilization in unlocking the full potential of climate action during and after pandemics. We therefore urge all key players in the devolution space and members of the public to now register and participate in the upcoming conference. Registration of the conference can be done through the conference website, www.devolutionconference.cog.go.ke. Status update on ARVs. We note that stalemate between Ministry of Health and USAID on ARVs has since been resolved, and we are grateful to the parties for resolving this. Further good news in respect to ARVs as well as tuberculosis and malaria is the commendable move which Global Fund has availed US dollars $447.5 million, which is equivalent to 48 billion shillings for the 3 diseases. However, there are emerging challenges as the foreign commodities out of, what is this now? It's okay. As the foreign commodities out of stock, that is viral load test commodities, as what was available expired in June. This has posed a major challenge in monitoring patients, which is vital in enhancing quality health care. Early infant diagnostic test kits and reduction of monthly ARV refills from 3 months to 1 month. In this regard, we urge the Minister of Health to fast-track the ongoing KEMSA reforms to ensure efficiency in provision of medical supplies in the county. We are summoning our representative in the KEMSA next week so that we can give him our requirements and for him to know what the role to be playing in KEMSA. In conclusion, as I conclude, I wish to emphasize that in the recent past, COVID-19 has continued to claim lives of our families and loved ones, as seen in the daily situation report by the Minister of Health. To avert this trend, we have to strive to flatten the curve by strictly adhering to the health protocols. We call upon all the citizens to exercise extra caution to protect themselves and lives of others in order to stem the spread of this virus. Asanteni sana, and I'm now ready for